friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in ElDorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And, at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, Fyzical, Ruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you. Welcome to Therapy Thursdays here on Louisiana Living. I'm Dr. Jerry Yarborough, owner of Physical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana, and ElDorado, Arkansas. And today we have a special treat again. We have Dr. Rachel Atkins here. She's one of our therapists here. And today she's going to be talking to you guys about diaphragmatic breathing and how it can help you.
That is correct. Thank you so much for having me here.
Thank you.
I'm excited to share with you guys today about diaphragmatic breathing and how it can help you in your daily life. First, let's talk a little bit about what it is. So the diaphragm is a muscle at the base of your rib cage that expands when you inhale. And so most of us tend to actually breathe into our chest instead of into our bellies. You might have heard diaphragmatic breathing referred to as belly breathing, but of course you're not actually breathing into your belly.
Right.
You're breathing into that diaphragm, but when that diaphragm expands, it pushes the contents of your abdomen forward. And so it's referred to as belly breathing at times. Now, when we do breathe into our chests and not into our diaphragm, we decrease our oxygen levels in our body by about 70%. So just right there, you can already see a big impact that has, in our lives. Now, not only do we decrease our oxygen level when we don't breathe into our diaphragm, but we also lose a lot of the benefits that come along with diaphragmatic breathing, such as decreased stress levels, decreased pain, decreased anxiety. We use this breathing technique with our patients many times to help them if they are dealing with high levels of pain. Another thing that's beneficial with diaphragmatic breathing is that it can help you go to sleep at night if you're having trouble going to sleep or insomnia. It can help you focus in times where your attention is needed. It can also be used anywhere you are where you might be having stress. So you're in a traffic jam and you can't escape that situation. You're in a difficult meeting. You're dealing with fussy children. You can't just leave the situation, but you can always use diaphragmatic breathing to decrease your stress and anxiety. So stay tuned and I will show you exactly how to do that.
All right, welcome back to Therapy Thursdays here on Louisiana Living. And today we are talking with Dr. Jessica Atkins about diaphragmatic breathing and how it can help you. And I think she's going to actually teach us how to do it next, right? All
yes.
right.
So in order to find out if you are taking diaphragmatic breaths or if you're taking chest breaths, I want you to do a little hands-on activity with me. So go ahead and take your hand and place it on your chest, and then place your other hand on your stomach just below your navel. Go ahead and breathe as you normally do, and notice what your hands are doing.
I'm all chest.
Are you? Yeah. Most people, as you might find, are chest breathers. Some of you may be breathing into your chest and your diaphragm, and a few select of you might be breathing into your diaphragm, but most of us do breathe into our chest. And so I want you to start to become more mindful of where your breath is going. Take a few more deep breaths, relax your stomach muscles, and try to breathe into your lower hand. Now, this is a habit that you will need to practice implementing. Many people find that it can take weeks for them to really learn how to properly breathe into their bellies and not into their chests. So give yourself some patience and take time to work on this skill. You might also find that if you lie down on your back, that you're better able to relax your stomach muscles. So you might try that. Now, I'd like to give you a technique that you can use to decrease your stress, anxiety, or pain level with the diaphragmatic breathing. And that technique is called 2-1-4 breathing. So go ahead and place your hands back on your chest and your stomach, and we're going to inhale for 2 counts, hold our breaths for 1 count, and exhale for 4 counts. So I will speak as you do the action. Here we go. Inhale, inhale, hold, exhale, 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 exhale. Now when you do this on your own, you're going to slow that down, and you can even close your eyes as you learn to do the technique. And I would recommend doing this 5 minutes at a time, up to 4 times a day, and then you can build your endurance to doing it 10 minutes at a time twice a day. So that would be practicing 20 minutes a day until you really learn how to properly breathe into your diaphragm. You can even teach your children this skill as you teach them to decrease their stress and anxiety and how to learn to better manage their own bodily stress. So I hope you find that 2-1-4 technique helpful and useful to decrease pain, anxiety, or stress, and even to help you sleep better at night if you're having trouble going to sleep. Enjoy practicing and good luck.
I actually kind of felt like I had more energy whenever I was breathing.
You definitely
diaphragmatically.
do.
So you guys give it a try, and you guys come back next week and see us here on Louisiana Living. We'll be talking about another topic. I believe we're going to have Dr. Rachel again. So you guys come back, and we'll see you next week.